0D iPhone stereo.
Okay, I'm going to be making a cup of Milo. Yes. I don't know if I want a little one or a big one. I'm going to have a little one. I don't step on it. I want. Oh, I've got to keep the repeat scripts, don't I? What's that one? That's. Oh, shit, fuck are they? That's this. All of my bloody folders up there. Oh, that's the other repeat script from the doctor's Friday. Don't know what that one is, so. Jeez. Wouldn't have a clue what that is. Put that up there for now. I don't just confuse people. Sorry, that would be the other repeat script here. And that one's another Milo. I'll make one. So yeah, the outing or the event that was downstairs at the Link Vision car park area was really good. I'll be going back next time it's on, probably next year.
Twitter now notification. Twitter now speech off.
So yeah, I've got my extra cup back. I can finally use it for what I need. And I'll see what the medical people have to say next week. If they don't give me any answers, I'll be asking for them because I want to know things. I think I have a right to know what's going on. I have a right to know what's happening with my life. And if I don't get myself sorted, and without trying to sound nasty to people, if you don't like how I live my life, that is too bad. You don't have to accept anything I do. That's your problem, not my problem to deal with. If you don't like it, then tough bicky, because you're not living my life. I am. And I treat the doctors the very same thing. If they can't accept how I live, I'll be finding a doctor who will accept how I live. I think that it's all about how much money the doctor can earn at the end of the day and less about helping people. And you can say what you like. I have experienced reality and I know that doctors don't care about their patients as far as they want to get the most out of their pay packet. Unless they feel that something's life-threatening today, if you say, I'm uncomfortable, and they think, oh shit, we need to help you out today because this is going to kill you, they will. They'll do anything to help you. But if you say, I'm uncomfortable and I've had this problem in the past and it's returning, they say it's not life-threatening, so you're okay with suffering. In other words, you have to stay sick if the doctor thinks it's not a life-threatening problem, and you can say that I'm twisting the system, or I'm just saying things that the doctor doesn't think at all, or you can say what you like. If the doctor was so helpful, they would say, I'm really sorry that you're not comfortable. You're feeling okay today, so let's see what happens next month, but we want to try and help you. Not, oh, do you want this? Do you want kids? Do you want sex? It's like, don't twist my words. If you can't help me, say, I can't help you. Don't give me all of these other excuses, because I get offended at people who make excuses. I'm less offended if the person says, I can't help you. I'll just say, all right, then I'll find another doctor. That's what I'll do. So I don't know if this doctor's referring me to a specialist, or rather saying she'll refer me to one and then she won't, or is she genuinely concerned and really wants me to get the help that I need? I don't know yet because I don't know her very well. She seems very nice, but I don't want to hear excuses. You either want to help me or you don't. Don't make excuses about my life. And if you don't like how I'm living, then you don't have to agree with it. But you do have to accept that I'm not living anyone else's life. I'm only living my life. I'm not here to make everyone else happy. If you want children and I don't, find somebody who wants children. That's how it is. I don't want any kids, so I'll be finding someone who doesn't want any children. And I guess he or she these days, I'll say he, for reference of I'm not a she person, I'm a he, well I'm a person who doesn't have attraction for other same-sex people. I'm not a same-sex relationship person, and I'm not getting into any arguments, but I'll say but, because but means that it doesn't matter about anything I've just said according to Dr. Phil. But anyway, what I'm saying is, I don't want a man who wants kids, because I don't want them. Then he can complain about me to the doctors and they'll do something about it. Maybe I won't get someone, and I'm not really sad if I don't get someone. I'm not really bothered. I don't have a problem if I don't get someone. I'm not concerned. You know, I'm not one of these people that is really clingy after a man, and you know, that's just how it is. Anyway, I'm after a doctor to help me be comfortable, not help me do something I don't want to do. I'm not after someone to pressure me into something I don't want. Being anything in life, anything in the world. Apart from a good joke and a good laugh and, you know, joking around about me wanting to do things, you know, making up jokes and stuff, I don't want to be pressured into a situation I don't want. So I'm just going to do what suits me. Do what you want to do. I'm doing what I want to do. I'm giving the doctor 6 months, meaning that I'm not going to drop her right away. If I'm comfortable with her in 6 months' time, I'll keep her. So it's December now, so December, January, February, March, April, May, June. I'll give her until June to decide if I want to keep her or not. If I'm uncomfortable with her in 6 months' time, I'm getting a new doctor. If I am comfortable with her in 6 months' time, I will keep her. I try to give people the benefit of the doubt. Obviously, if the doctor is not helping me at all, then I drop them immediately. But if they are doing the right thing by me and determined to help me out, but there's just some things that we clash on, then I give them plenty of time to decide if they like me as a patient or if I like them as a doctor. Plenty of time. And then obviously if, you know, any earlier than 3 months, if somebody has conflict with me and starts talking about my regular doctor in a nasty way, and then is acting nasty towards me because this doctor doesn't like me or my regular doctor, agreeing to certain treatments that this doctor doesn't like, then I'm going to find a new doctor's clinic with a new doctor who isn't going to have conflict with other doctors, who will do the right thing by me and who will try to help me as much as they can without pressuring me into doing things that I don't consent to. I will give this doctor 6 months, and then if I still like her, I'll give her another 6 months. So, you know, and then after 12 months I may be sticking with her for life. So, yeah. That's pretty much how I'm working this whole thing out. I do like my original doctor. my original regular GP. But another doctor at the same clinic was very nasty because she doesn't like me or my regular GP. She wants the regular GP to stop treating me, and I thought, the doctor's not allowed to do that. I'm going to get rid of this doctor's clinic and go to a new one. And then that other doctor who I had was very out of date. He didn't follow modern medicine practice whatsoever. He was very old school, and I understand prescribing minimal medications, but not to the point where people aren't going to get better. I mean, that's just selfish and nasty. And I thought, well, he's not going to help me, so went to a new doctor who is helping me a lot. She refuses to do certain tests, and if she says, no, I need to get you another specialist, I can say, fair enough, but you can't pressure me into something I don't want. If I need you to do something, it'll be for a good reason, not so that you can pressure me into things. So she doesn't want to deal with... Oh, I think that makes her a bit of an incompetent person, actually, because GPs are supposed to be medically trained for 8 years or more to handle any situation. And these days, I think that the medical system these days doesn't make people competent enough to handle situations like they should do. You know, they have all these doctors trained up, and they can so-called work with a dummy and work with a vomiting computer system that pretends to vomit and that, work with a supervised test subject, work with everything, but in real life they can't even apply their bloody skills. They can't even apply their skills in real life. And I think, why do they have all this training for 6 years and another 4 years of supervised experience, and yet in real life they can't even help you? They can give you a tablet, but they can't do anything else. I just find that quite weird, that as we move on in society, you know, everyday life, doctors seem to be getting more incompetent because they want to avoid responsibility, and if they don't feel your problems, then they don't care about your problems. Like, whatever, out of sight, out of mind. If you're not comfortable but you look well on the outside, they don't want to know why you're uncomfortable. They like, so long as we can't see that you look sick, we don't actually care how you feel about your body. We only care if you're bleeding to death or you need a tablet for something because you're going to die if you don't have a tablet. Well, I might die if they don't help me with my discomfort, because one day I might stop eating. Or maybe every month I'm going to stop eating for 3 days and end up malnourished slowly over time. And the doctor can say, if you don't look uncomfortable but you're complaining, we don't want to know. And even if they do see that you're uncomfortable, if it doesn't suit their expertise to say, yeah, we want to help you out, all they can say is, good, you can stay uncomfortable. Like, you know, I know a blind person now who suffers from back pain, and in the side, and his back, and in the side, and the doctor keeps on dismissing his pain. Just says, oh well, go home. No medical treatment whatsoever. And that's, you know, a bloke. Women get treated worse than that. So my opinion is that the doctors are not concerned about anyone but themselves. They just want to cover themselves. They don't want to help anyone. And I've always believed that people don't care about anybody. I believe that the reason so many people kill themselves in the world is because they know that nobody cares. And then when people say, oh, I'm worried when you want to commit suicide, well, no, they're not worried about you. They're not. They say that because they want to sound innocent, but they're not worried at all. Of course they're not worried. I know nobody worries about me when I get sick. No one gives a stuff about me when I'm sick. I know that's true. It's reality. The only person who cares about me is myself. The doctor just prescribes medication because they don't want to be sued if I die. There's no other reason for why they prescribe medication. They don't care about me. They don't feel any pain. They're just prescribing medicines so that they feel good that I am not going to die and they are not going to get sued. In real life, in reality, they don't give a shit why I'm sick. They don't care why they're prescribing medication. They just care that they're getting paid to make me better so that they aren't going to get sued. And when they don't want to help you, when they have a list of excuses not to help you, that's because they know they won't get sued for it. That's why. If they can get sued for something that you want help for, they won't let it go. They'll help you. When they realise, oh, we can get away with not helping you with certain problems and they're not going to get sued if you stay unwell, then they'll get away with anything. Doctors are not concerned about anybody. They become doctors either to harm vulnerable people in a medical setting or to get paid to make someone well so that they aren't going to get sued for the death or harm of a person, or to get paid, to leave someone ill if they know that the person won't die. Which means if you refuse medical treatment, legally the doctor has to say, oh, you can't refuse medical treatment. We've got to make decisions to make you well and get treatment that you're refusing. That's not because they care. That's because they know they'll be sued. If you refuse treatment and you get really crook, your family is going to sue them because they didn't stop you from refusing treatment. Otherwise, the doctor wouldn't get sued. You would get away with refusing treatment. And if they could write on your death certificate that you died of, say, septic shock and all this other stuff, and then the family doesn't sue the doctor, they can get away with letting you refuse treatment. They can say all these other legal things about, oh, they don't want you to get sick, they don't want you to refuse treatment, but in reality, they'll let you get away with anything because by law they have to be responsible for your welfare, but really they don't enforce it. They enforce things based on what they won't get away with. So if I get cancer tomorrow and it's melanoma, and I say to the doctor, no, I'm not going to get my melanoma taken away, I don't care, they'll say, oh dear, but you'll survive if we take it out today. If you leave it for 6 months, you'll probably end up getting, cancer spread all over you. Really, they're saying that to cover themselves because they know it's true, but do they really care if you refuse treatment? No, because it's a business for them. So obviously maybe you might find individual doctors who really care, but I don't know anyone who actually cares. I don't know any doctor. I mean, yeah, there are nice people, but I don't know anyone who genuinely cares and wants to help me in a genuinely caring way. All the doctors I've known so far, some were very nasty. There was another doctor who I liked but I don't see anymore, and she was actually very caring, meaning she would probably do what this doctor does. Maybe she'll refer me to a specialist. If I went back to see her and said my birth control isn't working, I bet you she would remove it and refer me to a specialist. Now, that's what all doctors have to do, but she seemed genuinely caring. She wasn't very good, as in she couldn't fill out paperwork properly, she made a lot of mistakes, she didn't understand blindness, meaning she doesn't recognise that people can be totally blind. She won't answer questions on paperwork properly. She required the ophthalmologist to do an eye report. She didn't want to tick that I'm totally blind. She wanted the ophthalmologist to do it. And she pretty much... There was a lot of things that she wasn't good with, I guess, as a doctor. But in a way, she was very caring. So there is reasons why I wouldn't see her anymore, and there are reasons why I would see her, but at least in her own way she tried to care about me. But anyway, I don't know any other doctor who truly, honestly cares about anybody. I don't know anyone who really cares. I went to a really lovely doctor the other day. She's very nice, but she cares more about how much money she can be paid and not being sued for the harm or death of her patients. So of course she'll try to help them, but beyond that she couldn't care less about anybody. She seems like a very nice person, but she's got a very selfish nature as well. It's all about her, and if you respect what she wants and she doesn't have to respect you, and she's nice to you as well, so long as you and her can get along, well, I suppose that's as far as you get with a relationship, professional relationship with a doctor. I don't find that to be very caring. I think that's all about her trying to get a profit. I don't know any doctors who really try to help their patients properly. I know an eye doctor, one eye specialist who does try to help people, and he's really lovely. Yeah, that's one doctor that I know of. He's an eye specialist. Usually they can be pretty horrible people, pretty selfish and upstart and everything like that. These GPs that claim to want to help their patients, they don't really. Yeah, they offer medications to get you better when you're sick, but it's all about not being sued. Otherwise, if they can get away with it, they won't try to make you well if they know they won't get sued for leaving you in a sick state, in a bad way. And if they find that you're refusing treatment, they basically avoid responsibility by saying you shouldn't refuse treatment and we have to decide that you need treatment. But really, if you can get away with refusing treatment, and if they can find a way around being sued, they're quite happy to let you refuse treatment. Even though they have to say all these other things so that they can't be sued if you get really sick or die from refusing medical care. So that's why I think that doctors have an ulterior agenda. They're not really out to care for people at all. They're just doing what they're supposed to do in order not to be sued, even if it means letting people neglect their own health. So, yeah. Besides that, I'm doing okay for the moment. I'm going to be having another fight with the doctor in a few weeks. Basically going to be honest with them and tell them that it doesn't actually matter, because, you know, all the reasons I discussed. I'm not about to change. You could send me to a psychiatrist and I'm still not going to change. I'll still have the same attitude in 12 months' time, and in 2 years' time, and in 3 years' time, and in 4 years' time, and in 5 years' time. I'm not going to change. Psychiatric care isn't changing how I feel about the way people are these days. I'm not saying nobody cares because I need antidepressants because that will make me think people care. I really think nobody cares. And you could give me 6 Valiums and make me completely loopy and happy and laugh, and I would still think that nobody cares about me. I might be very happy with my life because I won't know where I am, but I still think that nobody gives a shit about anybody, only themselves. Nobody actually cares. And I would say that on drugs as well. Nobody gives a shit. I have a care company now that reckons that they genuinely care. I'm like, yeah, sure. Repeating yourself every week isn't going to make me think any better. Because in critical thinking at university, when I did a tertiary education program, which gives you qualifications for entering uni, it gives you qualifications so that you can start a bachelor's degree, pretty much. And I did critical thinking as one of my subjects, and I read and learned that repetitive arguments is not a premise for a true statement. Just because you tell me something over and over and over until I believe you that you must be being truthful doesn't mean that you're actually being truthful. You can tell me every day how much you love me until I believe you next month that you must really love me. Doesn't mean that you honestly love me. Doesn't mean that at all. Critical thinking is all about knowing objectively what the truth is in reality. And you can tell me over and over and over that you mean to be a nice person, and you might mean to be a nice person to help me out. But what you say means nothing whatsoever unless you can show me that you really care about me. So obviously when a doctor says I don't want you to stay miserable and I do care and I want to help you, then they give me medication to make me well. That does show me that they mean what they say. But as soon as I say I am uncomfortable with XYZ part of my life, I have had problems in the past with XYZ, I would like to stop XYZ issues, then they say, we'll stop XYZ issues for you, but guess what? You're going to have to deal with X, Y, and Z twice a year. That makes me think that the doctor is trying to avoid responsibility. They're trying to weasel their way out of a fallacious statement such as I want to help you stay comfortable. And then they're saying that, oh, you're going to deal with discomfort twice a year. That is not a true statement. That's a fallacious premise. Your argument is that you want me to be comfortable. So your premise is that I'm going to get a medication to keep me comfortable. Then you say, but. You've just admitted that you have presented me a fallacious statement with a false premise. You want me to stay comfortable is your premise, and your statement is, I will have this treatment to stop X, Y, and Z issues. Then you're telling me that you're going to reduce them so that I have twice a year issues. You have just lied to me in a legal way. You have legally lied to me. So my critical thinking, according to this tertiary education program that I did, my critical thinking is, you've told me 1 minute you're going to help me and I won't stay miserable and I'll be comfortable. Next thing you're telling me I'll be uncomfortable sometimes, and I have already told you, please help me to stay comfortable and stop my XYZ problems. I've just told you that. Now you've told me a lie and said, yes, I'll make sure that I'll stop your problems with medication every day. That's okay, yes. That's a lie, because all of a sudden you're telling me, but you have to put up with X, Y, and Z issues every 6 months because of what you want. It's not about me anymore, it's about you. So really, what you're telling me in a critical thinking way is, you're okay if you take medication every day to reduce a problem to having an issue twice a year, even though you said you want to stop X, Y, and Z issues and you want to stay comfortable. Okay? I have proven that the doctor has lied to me. And I called her out on the spot by saying, I actually said I was okay to take medication every day if my problems stop. Not if you want to reduce my problems. If my problems are going to be stopped, I'm okay with taking medicine every day. If you are not going to stop my problems, I am not okay with it. So, do you want me to take medicine every day to stop my problems completely? Or do you mean that I should take medicine every day to reduce my problems? If you're telling me that you want to reduce my problems, that isn't giving me what I want, and no, I am not okay with it. I will only be okay with an option if it does what I want it to do, and you are not doing what I want you to do. You are telling me what I don't want. I'm telling you what I do want, and I want you to respect me or I'll find a new doctor. I didn't physically openly say that in a direct way, but I kind of implied that to her. So then she realised that I caught her out lying to me, because she wasn't being objective. I was saying, stop my problems. She said, take your medicine every day to stop your problems. But, you will have your problems twice a year. And I said, no. I want to stop my problems, not reduce them. Stop them. So now I know that my doctor is dishonest with me, and I'm going to make a complaint to the care company about that. I'll talk to the ladies, and I'll talk to my grandmother, and I'm going to complain about that. And I'm going to make sure that the specialist who sees me gets to know the truth about that as well. Because I'm pretty good with critical thinking, apparently, and they are not very honest or objective. It is all about the rich man's world. It is all about the profit and the lack of concern for other people that they are meant to care for. And, you know, once again, it comes back to, we'll help you, you know, if we think we'll get sued if we don't help you. So if they don't help you, they'll get sued. If they think they can get away with leaving you in a bad way, they'll find every way possible to get away with not helping you. By lying, not being objective, not giving you what you want, twisting what you're saying, just not helping you, you know, abandoning you. They'll find every way not to help you. So, yeah, that's my opinion about doctors at the moment. My personal opinion is I don't understand how people like to be uncomfortable. I do understand some situations where you want to get better, but sometimes you need to take medication to get well, and you might get sick along the way, and then you get better and you're okay. Look, I can understand that. But why would you want to be uncomfortable and sick and stay unwell when you know that you can find options for getting better? You don't have to stay ill unless you want to, unless you've got a serious condition that you can't get well from, which I understand as well. But if you say, look, I'm uncomfortable but I want to stay sick, I just don't want to get better and I just don't want any treatment, you know, God, why? And yet I can understand if the doctor doesn't want to help you, just say, look, I want to stay sick because you're not helping me. That I could understand. But just, I feel like staying sick, I don't want to get better. It's like, what? No. No. So yeah, that's my whole opinion on this bloody system. So yeah. And this Milo is absolutely beautiful. Yum. Spilling milk everywhere. God. Right. That was yummy. Yummy. Yum. It was very nice. That was great. Very, very good.
Minus 50 dB.
There? I hope I've recorded everything properly. I might have to stop this recording and play it just to see why I accidentally stopped the recording. God, I hope I haven't been wasting my time speaking all that time when it wasn't recording. Oh, God.
Settings. Record. File list. Stereo.
Anyway,
M4.
let's
iPhone.
see
Pause. Stop.
what
Button.
happens, but I had a good day. I don't really want to keep talking about medical stuff until, of course, the next appointment comes up. Yeah, I need to, I'll deal with that next time. So that means if you want to know any more medical questions, for example, Stephanie or Tori, I will obviously say, oh, well, I'm waiting for test results, so I'm waiting for a doctor to ring me back, but I won't go into extensive discussions anymore until such time as I know what's going on. So yeah, don't assume that I appear short or abrupt with you guys if I happen to not say much. It's just because I don't know, and I guess on these recordings I've said everything I need to say, I suppose. So unless I know what's going on, I won't know how to answer any more questions apart from, oh well, I'm still waiting on phone calls, I'll make another appointment. I need to talk with the care company to see what they can do to provide support with all of this stuff. And, I need to get my teeth looked at and everything. Obviously, when I know what's going on, I guess I'll find out at these appointments and with these phone calls. And I guess, that's when I'll know what is going to be expected in the next few months. Give and take 6 months. So, yeah.
Stop. Button.